dear colleagues from the Ministry of Health, from Istanbul Public Health Directorate and Health Directorate, from Columbia University, dear panelists, colleagues, esteemed guests. It's an honor for me to be present among you today for this workshop to talk about the health of migrants, which is very relevant and important nowadays. Conflict, prosecutions, and poor living conditions are leading thousands of people to leave their countries, to seek refuge and safety in Europe. People escaping difficult situations face long, dangerous journeys in which their lives and health are at risk. Responding efficiently to their health needs is essential for preventing and controlling human disease and limiting suffering. The increase in number of refugees arriving in and traveling through the region shows no sign of abating. According to UNHCR's estimates, till 15th of October, over 589,000 refugees and migrants crossed the Mediterranean Sea to reach Europe in 2015. And 3,095 died trying to do that. To date, approximately 136,000 refugees and migrants have reached Italy, and more than 450 entered Greece. And we all are following the news about the numbers in Germany and other European countries. Since the enforcement of the new border laws in Hungary and the partial closure of the Hungarian-Serbian border, thousands of people have been arriving daily from Serbia on their way to Croatia. Such dramatic increase in migration highlights the need to identify best practices and engage dialogue on migration. The issues surrounding health and migration are important for a number of key reasons. They are not only relate to the ethical implications of unequal access to health, but also are linked to avoidable costs of health for health systems and wider community. The health problems of the refugees and migrants are no different from those of the resident population of the WHO European region. The dangerous journeys that these people take can, however, worsen the health of those with chronic diseases. Deteriorating weather conditions and a drop in temperature can result in health problems such as respiratory tract infections. The latest report from the WHO country offices showed that upper respiratory tract infections, hypertension, head trauma, renal disease, physical injuries, and uncontrolled diabetes are among the main health problems of refugees and migrants in Europe. Promoting interagency, interregional, and international cooperation on migrants' health is one of the essential tools to address the public health challenges and to ensure equitable access to health services. Responding quickly and efficiently to the arrival of large number of people from abroad requires effective preparedness, coordination, resources, and collaboration between and within countries as well as between sectors. A good response to the challenges faced by migrants groups requires building adequate capacity in the medium and long term, requiring robust epidemiological data on migrants, on migration, intelligence, and careful planning. In this context, I would like to commend Turkey, who has welcomed almost 2.4 million refugees, and I quote this figure from His Excellency Under Secretary of the Ministry of Health, who was in Gaziantep 2 weeks ago, together with the GMDD. They quoted the number of 2.4 Syrian refugees now in Turkey. The largest influx of refugees in the world, as we know, is now in Turkey. The government of Turkey has displayed tremendous efforts, and most refugees in the territory have access to health services, thanks to the outstanding work of the Ministry of Health and Turkish health personnel. Migration is considered a major political and public health challenge for WHO European region. In this regard, taking into consideration a number of needs and high-level dialogue on the multidimensional aspects of international migration and development, and in order to minimize the negative impacts, WHO World Health Assembly shared and accepted the resolution 6117 on the 61st meeting of the Assembly in 2008, which is like 7 years from now. WHO, with this resolution, considered the health needs of migrants in the framework of the broader agenda on migration and development. In this framework, the broader agenda on migration and development recognizes that health outcomes can be influenced by the multiple dimensions of migration and takes into account the determinants of migrants' health in developing intersectoral policies to protect their health. WHO also noted that policies addressing migrants' health should be sensitive to the specific health needs of the women, men, and children. Within this resolution and with these goals, WHO called upon its member states to promote migrants-sensitive health policies, to promote equitable access to health promotion, disease prevention, and care for migrants, subject to national laws and practices, without discrimination on the basis of gender, nationality, or race. To establish health information systems in order to assess and analyze trends in migrants' health. To gather documents and share information and best practices for meeting migrants' health needs in countries of origin or return, transit, and destinations. To raise health services providers and professional cultural and gender sensitivity to migrants' health issues. To promote bilateral and multilateral collaboration and cooperation on migrants' health among countries in the whole migratory process. In addition, and through the public health aspects of migration in Europe, FAME project, WHO Europe is working closely with member states to strengthen the health sector's public health capacity to better address emergency-related migration. This focus also was arising from the recognition of the revised International Health Regulation 2005 and its provisions relating to international passenger transport. Reinforced epidemiological technical networks as GORN and others are among some of the available systems that will support our good responses. The main purpose of such cooperation should definitely contribute to the sustainability of health systems and attain the desired health goals. With the ultimate goal for Health for All, Health 2020, we all work for attaining that everybody should have equal access to health and for sustaining the health systems in terms of readiness for public health challenges. WHO continues its collaboration with the countries and its European region, and WHO Regional Office for Europe Task Force on Health and Migration is supporting member states by procuring medical supplies and equipment, training health and non-health personnel working with refugees and migrants, providing guidelines, conducting joint assessments, and producing information materials to diffuse misconceptions about public health and migration and to promote evidence-based public information. In September, joint assessment missions with the Ministries of Health has been conducted in Bulgaria, Cyprus, Greece, Italy, Malta, Portugal, Serbia, and Spain to address multicultural, complex, and rapid issues in health and migration. In Turkey, WHO has a long presence, our office in Ankara, And recently, WHO established a field presence in Gaziantep in October 2013 to help with meeting the public health needs of refugees, in close collaboration with the Ministry of Health and its partners. Actually, in Gaziantep, we have two programs: the refugee program, which is for Syrian inside Turkey, and we have the cross-border, we call it the cross-border operational program, which supports the Syrians inside Syria. What I'm going to talk now is just focusing on the services or WHO activities inside Turkey to support the Ministry of Health and partners to provide health services for the Syrians on the Turkish land. We have conducting research and assessment to identify priority needs of Syrian refugees. We are about to start data collection for assessing the access to mental health services and the needs of the Syrian refugees regarding mental health, psychosocial support, and this activity is done through Ministry of Health and an independent consultant and data collection body for this activity. Another assessment on immunization access and coverage among Syrian children in Turkey will conclude before the end of 2015. Again, this is a joint activity between WHO and Ministry of Health. WHO in Turkey is providing support through capacity building of Syrian medical staff. These trainings aim at familiarization and possible integration of Syrian health personnel to health system in Turkey to serve Syrian population. With the cooperation of the Ministry of Health, Gaziantep University, Yildirim Beyazıt University in Ankara, 66 Syrian doctors have attended refugee doctors adaptation training, and 19 nurses attended refugee nurses adaptation training. WHO continues these trainings with full support from its partners and aims to conclude this training with 175 Syrian doctors and 75 nurses by April 2016. And this is one of our main activities in collaboration with our partners, Ministry of Health, Gaziantep University, and other universities. We started this program talking with Gaziantep University early 2014. And we are very glad to hear about the possibility that the Ministry of Health, within a framework of legislation, may give access to the Syrian health personnel to serve their population in Turkey. As I understand, again, I quote His Excellency Under Secretary of the Ministry of Health, this legislation may come very soon. I'm not encroaching or jumping on our colleagues here from the Ministry of Health, but I just want to tell you, because for us it's very good news, and we are waiting to see it materialize, inshallah, in the very near future. WHO country office in Turkey is continuing its technical and financial assistance for outbreak response, supply of medical equipment and drugs for some health facilities. Latest was Suruj Health Facility in Suruj camp in southeastern of Turkey. We are working to increase health awareness of Syrian refugees and provide them with information on access to health services through dissemination of information materials. We have 6 information leaflets now in process of production. Again, we are doing that with the Ministry of Health and in collaboration with some NGOs or some of our partners from the NGOs. WHO support policies that provide healthcare services to refugees and migrants irrespective of their legal status as part of the universal health coverage. For that, we are working closely with Turkish Ministry of Health to address the challenges in provision of health services to the refugees, which includes access to health services. And under the access to health services, I would like to mention the language barrier. Language is a main concern for the Syrian patients and for the Turkish health personnel as well. Translation is not like the best way of providing health services, although it's very important. Translation cannot, from my point of view, I'm a medical doctor and I know the doctor-patient relation. Translation will not help building such relation in a very easy way. We have problems with the quality of the translation. We have problems in the numbers of translators, a lot of issues concerning that. So as WHO, we are welcoming and we're very glad with the establishment of the Migrants Health Centers. His Excellency Undersecretary requested WHO to support such activity in terms of calling for more civil society NGOs to get engaged in establishing migrant health centers. And according to His Excellency, it's planned, the Ministry of Health is planning probably 200, maybe in 2016, I cannot remember the date. And he called WHO also to work on fundraising for these NGOs or these agencies that will run some of these migrant health centers, and we welcome this initiative with the Ministry of Health. Another problem related to the access of health services is lack of information at the refugee site regarding availability and access to health services and rights on access to health services. They do not know, simply. Refugees, they have lack of information on their rights to access health services. Because of the high burden in some facilities, the time allocated to the patients are too short, which may hamper the quality of the services. We are talking to the Ministry of Health in Ankara, and hopefully we may be able to launch an assessment on the quality of the services, tackling this specific point and maybe others as well. There are problems related to the referral system we have identified and shared with the Ministry of Health. It's the communication both ways between the primary, secondary level. There is lack of communication, and we have conveyed again this issue to the Ministry of Health, and the Ministry of Health is working on that. Different interpretation and practices in implementation of Prime Ministerial Circular on Health and temporary protection regulations among provinces. Continuous movement of population, Syrian refugees, leading to interruption of public health services such as antenatal care, immunization, and others. Waiting for the legislation to enable Syrian health staff to support Turkish health system through serving the Syrian population, as we have mentioned. Difficulty in getting information from the routine HMIS. Interruption in continuous and regular information sharing, and we have raised that again with His Excellency the Undersecretary, and he promised to work on this issue. Priorities and plans are difficult to be based on evidence due to lack of information at different agencies level. WHO has been and ready to support and work with the Ministry of Health and our partners as much as needed. At the end, I would like to thank all of you for the kind invitation to WHO to participate today with you in this important event. Thanks to my colleagues, Columbia University, Ministry of Health, and all of you. Thank you.